to our Healthcare Week of Action for the Wausau kickoff. My name is Claire Zotke, and I am the Healthcare Director here at Citizen Action of Wisconsin, and I will be moderating our virtual press conference today. We're really excited that you all are tuned in and are going to listen to us talk about the important healthcare initiatives in the state budget that we support. So for a little bit of background information, Citizen Action of Wisconsin is partnering with Lieutenant Governor Mandela Barnes and legislators across the state to talk about the important healthcare investments in Governor Tony Evers' state budget, including but not limited to BadgerCare expansion that will bring an unprecedented additional $1.5 billion into the state of Wisconsin, prescription drug affordability measures to bring down the price of excessively expensive drugs and medicines that people need to live, and the option to, or the ability to create a state public option that would allow people to purchase their health coverage directly from the state. These are incredibly important initiatives that will make healthcare more affordable and higher quality for people all over the state of Wisconsin. And it's really important that we get the word out that Wisconsinites support these initiatives and that we're calling upon the legislature to adopt these programs. So we have a great lineup of speakers today to speak to you. So the first speaker, of course, that I'm going to pitch it to is our great Lieutenant Governor Mandela Barnes. Take it away, sir.
Well, thank you so much, Claire. Thank you all for being here. Thank you for joining us. And I know that you mentioned Governor Evers' budget, but I want to be very clear in saying that the provisions of this budget, especially the healthcare provisions, as it relates to expansion of BadgerCare, these are suggestions and ideas that the people of this state have called for a very long time, whether it's through our public listening sessions that we had for this budget or the budget 2 years ago. And even research shows that an overwhelming majority of people in the state think that we should expand options for healthcare for people all across Wisconsin. So again, thanks, Claire. Thanks, Citizen Action, for having me. The reality is that there are far too many children, far too many families and people in our state that haven't had access to quality and affordable healthcare. And the fact is, they deserve it, but don't get that access. And the last year has shown us how seriously we need to take health access. And it's an issue, like I said, that's been going on for a long time. And many have taken action to try to close the gaps we see. But as we know, there's still so much work for us all to do. And this is an issue that's been important to me since before I was Lieutenant Governor, before I was in the Assembly. These were the same issues we advocated when I was an organizer. And like I said, this past year has made it abundantly clear how critical healthcare and access to it is for everyone across our state. And we've seen nurses, doctors, and public health professionals make incredible sacrifices to keep us safe. And we were forced to recognize how an untreated medical condition could suddenly become a life or death situation. And as we've known for too long, it could also become an issue of bankruptcy for people. And millions across the country lost their health care because they lost their jobs, which is completely unfair. It is just immoral, the idea that someone who could deal with the prospect of one, losing a job, not knowing where their next paycheck is going to come from, may not even know where their next meal is going to come from, and then on top of it all, lose access to health insurance in the middle of a public health emergency. But in our last budget, we fought to expand access to tens of thousands of people and invest in improving our healthcare system for everyone. Now, with the Badger Bounce Back agenda, we are building on that work so that we'll be able to recover from the pandemic and make our communities healthier and stronger than they were before the pandemic. And our plan expands BadgerCare to over 90,000 people in the state so that they can have quality, affordable healthcare coverage. And we also want to create a state-based healthcare exchange so that we can meet the needs of people of this state and also invest in affordability at the same time. And what's particularly exciting to me, which I've been an advocate for a very long time, is authorizing the Office of the Commissioner of Insurance and the Department of Health Services to develop a public option for health coverage in our state. Our agenda also tackles the skyrocketing prescription drug costs, which, as we know, is a main driver for the cost of overall healthcare. but we want to make sure that we're prioritizing controlling costs where it want to increase transparency and oversight, and also strengthen consumer protections, and to also bolster our programs that are designed to support our state's most vulnerable citizens. And that's why we are calling for the creation of the Office of Prescription Drugs Affordability, so that we can provide oversight to the pharmaceutical supply chain. And we're also establishing a $50 copay cap on insulin to make sure that people can afford the insulin they need to survive. We see so many horror stories about how people have to split up their prescriptions or stretch it out so that it can last just a little bit longer because the cost is through the roof. And that's why we also are seeking to provide $4 million in increased funding for free and charitable clinics and also community health center grants. And these are the three pillars of our plan to do exactly what we are able to at the state level to make sure that healthcare is affordable and accessible. And we're working to build support all across Wisconsin for this budget and to also make sure that it gets passed through the legislature. But I cannot stress this enough. We need your help to make this happen. We need Wisconsinites all across the state, all across the political spectrum, because as the research and the data shows, this is not a partisan issue. So please stand up for a healthier Wisconsin. Please help us get these priorities turned into realities. And so with that being said, I am happy to hand it back to Claire and just want to say thanks for having me.
Yeah, thank you very much, Lieutenant Governor. We're really lucky to have champions like you looking out for Wisconsinites and their health. So I want to pitch it now to our second speaker, that is Lisa Ort Sondergaard. And Lisa is a very recently a former business owner from the greater Wausau area, and she's going to tell her story about why it is so important from an employer perspective that folks in the community have high quality health coverage. Lisa, take it away.
Thank you, Claire. Good morning, everyone, and thank you to Lieutenant Barnes for being with us. And I also want to thank Citizens Action of Wisconsin for giving me this opportunity to share my story. Like Claire said, my name is Lisa Ort Sondergaard. I was raised in the rural Northwoods, somewhere between Rhinelander and Crandon. Neither of my parents graduated from high school as they married very young. My mother was born in a real log cabin and grew up extremely poor, as she lost her father when she was just 12. My father lived on his own from the time he was 14 years old and learned the trade of being a logger, or as he called himself, a lumberjack. I'm the youngest of 5 children, and by the time I came along, my father had his own logging crew. I awoke most mornings to the smell of pancakes or eggs and bacon frying, as my father often fed his crew before they headed off to the woods. Every Friday evening, the crew again gathered at our table as my father paid everyone for their week's work. It was tough and dangerous work. They were often battling the extreme cold temperatures and hip-deep snow in the winter of the Northwoods. And of course, falling trees is just dangerous work. It just is. My father was often worried about, employees getting hurt at work. He did not offer his employees insurance for healthcare. In fact, our own family didn't have healthcare insurance. I'm not really sure if most people in the Northwoods had insurance at that time, because who pays attention as a child? My mother always wrote a check every time any of us went to the doctor for strep throat or stitches. I had 4 brothers, so you can imagine that there were a lot of blood spilling on our rural home there, and made frequent trips to the big city of Rhinelander. I remember that as my mom would write the checks, the few times that I was actually at the clinic, and she would grumble as she wrote the check, and it was usually $25 or $40, but she would grumble, oh, now I can't have this new or that new, because she had to pay the doctor. I also remember my dad often loaning money to his employees when a new baby was born, or someone was sick, or there was an accident. He would loan them money to pay their bills. I'm not really sure how often he recollected those loans, as that was also a frequent conflict between my parents. So by the time I was a teenager, My mother had numerous health issues, nothing really serious, but things that required hospital stays or surgeries. And I often heard my parents complaining or fighting about the cost of that and how they had to make payments on that. So I decided as a fairly young person that I needed a job that provided healthcare insurance because it's something my family never had. So I decided that I needed to go to college because I didn't know any other way that that was going to happen. I was the first member of my family to ever go to college. My first job out of college was as a child protection worker in Pierce County, which is the western portion of our state. It was an extremely stressful job. And I would often complain to my dad when I came home about the stress. And he would always say to me, you better just keep that job. It's a really good job. You even have health insurance. So by that point, he recognized what a value that was and that it wasn't available to me any other way than through my job. So I kept eating my Rolaids and drinking my Pepto-Bismol as I went to work, tried to deal with the stress because I had a good job with health insurance. As time went on, I met and married a man from rural Minnesota who grew up much the same as I did. His father owned his own electrical business, and the family of 5 boys had no health insurance. He went to college, also the first in his family, with the idea that he would be able to provide a better life for his future family. During college, he started out in the summers working as a construction laborer. He learned to cut concrete, which was a union paid job. And after college, he kept cutting concrete because it paid better than most entry-level jobs that he was qualified for. So flash forward our life to 1997. We had 2 young children, and I had quit my social work job to care for our 2 daughters. My husband worked ridiculously long hours to provide for us. As a concrete cutter, he sustained a few minor injuries through his work and was suffering from a repetitive motion injury back in the days when concrete cutting was no technology. It was a very manual labor kind of job. So brushing our daughter's hair became an agonizing chore for him. And we just decided after 20 years of that, he needed to do something else. His quality of life was suffering from that. So we moved to central Wisconsin, Edgar to be exact, because my parents had resettled here from the Northwoods after they retired. And we opened our own construction business, cutting concrete. We did that with a small SBA loan and the proceeds from selling our home in River Falls, and tried to start anew here. By that time, I had earned my master's in social work, and I went to work as a school social worker in the Wausau district. There, I discovered, of course, the many, many stories of people who couldn't afford medication their children needed or the families needed. They made just enough money to not qualify for assistance with healthcare. And as Lieutenant Barnes said, we're rationing medication or just choosing not to have it because they just didn't have access to it. So personally, my job allowed us to have health insurance, my family, and my husband worked to launch our business. When we opened our business, my husband and I made the decision that we were going to be a union employer. We had both been union members through our jobs, and we knew that provided good wages and it provided health care for our family. So as employers, we wanted to do the same for our employees, and that was the only real option available to us to make sure our employees had health care coverage. And we knew firsthand that construction is a physically taxing industry, and it's rife with potential for injuries. So it was just really important to us to provide healthcare coverage for our employees. We started out with just 1 employee and my husband, and over time we grew to have 12 employees that were all laborers. people in our industry, the concrete cutting industry, are not union employers because of the cost. So they just choose not to do that for their employees. But again, we were committed to providing that for our employees. So for 23 years, we were a union shop. Recently, as Claire said, very recently, in January, we sold our company to another union employer. And this was an important consideration for us when we were making our transition plan, because we knew our employees were the primary reason for our success. And we knew the fact that we provided union wages and benefits, particularly healthcare, was partially responsible for us attracting and keeping employees through the years. In fact, one story that my husband shared with me last night as we were talking about this was one of the first employees we hired actually told us that he had no concrete cutting experience, but he was applying for this job because he had a family member with a pre-existing health condition that precluded them from getting health care any other way. So even though he didn't have experience, we liked his story. We thought, yeah, you're a good fit for us. We want to be able to provide this for you. So we hired him despite his lack of experience in our industry. We never regretted that decision. He worked for us until he himself retired. So it worked out well for his family, and he was a great employee. We're proud of the fact, my husband and I, that we were able to provide jobs to many local people in the Edgar, central Wisconsin area that not only provided good living wages, but also provided for their health care, so they could provide for their families. So that's kind of my story. Claire, thank you for inviting me here to be able to share this. And Lieutenant Governor Barnes, I just want to say thank you for fighting for these things. You're right, Wisconsin we've needed these things for our people for a long time, and I'm really hopeful that we can get this passed. Thank you.
Thank you, Lisa. I think Lisa's story highlights the contrast between her experience as a child in a family that didn't have health coverage with the quality of life that she and her husband were able to provide to their employers when they did decide to offer health coverage. Really shows the difference in the quality of life that affordable and high quality coverage can make for folks in our state. And to really bring that point home, I want to introduce our next speaker, Krissa Estenso, who is a healthcare provider and employer. So Krissa, take it away.
There we go. Thank you so much. Yes, my husband and I have owned and operated and enjoyed doing that, owned and operated an optometry clinic up here in Ladysmith, Wisconsin since 1991. As a small business owner serving my community as a healthcare professional, I really see firsthand every day how our unaffordable healthcare system affects my community. Health insurance companies are gobbling up our nation's healthcare resources as we watch small clinics like mine become a thing of the past. Rural communities lack providers, and hardworking Americans struggle to afford the care they need. A big part of my job at the clinic has been insurance billing. It requires navigating hundreds of plans from dozens of different insurance companies, which all change every year. It's really just a tangled mess of red tape. Patients have no idea what their coverage is. Providers have the burden of researching their coverage and then explaining it to patients who are often frustrated because they've been led to believe that their plans cover much more than they actually do. Technology has helped with the burden, but it still has proven to be too much for many small private clinics like mine, and we are a dying breed because of it. At our clinic, we have 4 employees. Over the years, we've wanted to cover them, but we have never had access because of the small size of our company to an affordable plan to cover our employees. We've always been told that we'd be better off out on the individual market. And we all know how unaffordable that can be. Over the years, it's just grown and grown, the expense of self-insuring ourselves, to the point where now in 2021, it's costing my husband and I $22,000 each year for premiums for a plan that you basically don't want to go to the doctor with, because we have a $12,000 deductible between the two of us as well. Due to high costs, some of my employees, like so many people in the community, have not chosen to purchase health insurance. Every day, we see people in our community that are avoiding the doctor due to lack of insurance or high deductibles. We see serious conditions like diabetes going untreated and wreaking more havoc on their bodies. Some people in my age group report that they're just going to wait a couple years till they're 65, and then when they get Medicare, that's when they're going to go to the doctor and take care of these building problems they're having. And we have known, I think most people know, people who've lost that gamble and have not made it to their 65th birthday. Having a front seat view of this healthcare system led me to become an advocate for national healthcare. I, like so many people, want to live in a country where people do not die for lack of ability to pay for healthcare. Right now, the pandemic and the federal relief bill have given Wisconsin access to more resources to allow us to take a big step toward more affordable care for more people. All we have to do is stop refusing federal healthcare dollars, which really appeals to a taxpayer like me, and accept the Medicaid expansion. More people will be covered, and more of the expense of covering all of our BadgerCare recipients will be transferred from our state taxpayers to the federal. We need to stop throwing our Wisconsin taxpayers' money away and expand Medicaid to cover up to 138% of poverty level under these federal funds. Then, as Mandela said, we need to allow families over that income limit to purchase BadgerCare as an affordable public option. Families need access to a plan with real coverage. They simply cannot afford to pay these high premiums for a plan that has such high deductibles that they won't use the plan anyway. I speak for thousands of doctors and healthcare providers who know that our system, controlled by for-profit insurance companies, is not working. And the only solution is working toward affordable public options. I speak for my community and its hardworking citizens who need affordable access to healthcare, including mental health and addiction treatment. I speak for small business owners who want their employees to be covered and know what freedom from the burden of healthcare bills can do for their employees, for their customers, for small businesses, new businesses, and the growth of our economy. I ask our Wisconsin legislator to move us forward with these common sense budget initiatives to expand healthcare in Wisconsin. Thank you for this opportunity to share my perspective.
Thank you, Krissa. That was wonderful. I think you articulated really well what BadgerCare expansion and a public option would do for your patients at the clinic, but also would do for your employees and your family, being able to get affordable coverage that people can actually afford to use, not just to pay the premiums of, but can afford to go to the doctor with, because their co-pays and their deductibles are more reasonable. So thank you very much for sharing that. That's it for our panelists. So I want to invite our friends from the media. If you have any questions for the Lieutenant Governor, for Lisa, or for Krissa, please pop them into the chat or the Q&A box on your screen. We have a few minutes that we could answer any questions that you would have. To give you a few minutes to type up your questions, I had a few questions that I thought about that I want to pitch to the panelists. So first, I have a question for you, Lieutenant Governor Barnes. It's one of the things that we talked about a little bit, but that we didn't talk about too much is the federal financial incentive that Congress and President Biden just passed in the American Rescue Plan that would bring over $1 billion of additional funding for BadgerCare if the state were to expand now. Can you talk a little bit more about what that amount of money would mean for the state and for local communities like Wausau and Edgar and Ladysmith?
Yeah, it goes without saying that it would be a significant help to make sure that we're able to get people the access that they need, especially in the Wausau area. It means that we can invest more in access and affordability for everybody in Wisconsin. So it doesn't just benefit those who are directly getting care from expansion, right? This benefits everybody, whether you are on BadgerCare or whether you have private insurance, whether you have employer-sponsored health insurance, which makes this a good deal for the business community as well. And this also means just getting our tax dollars back to the state. It means that the money that we send to Washington, D.C. doesn't go to our neighbors who made the wise decision to expand their Medicaid programs.
Yeah, I really appreciate that, and I think that I've heard that this funding can also go a long way to being able to expand access to coverage and doctors in like rural areas where there's less density of healthcare practitioners, and also that there are other health equity initiatives that can be funded through BadgerCare and just in general through the state budget. And I know you've been a champion of health equity for a long time. I was wondering if you could also talk to us a little bit about sort of some of the health equity provisions in the budget that are exciting.
Yeah, I'll start by saying health equity is, again, it goes without saying, incredibly important. Too many of us have healthcare stories. I do have my own health care story. Fortunately, it wasn't a life-threatening event, but it was an event that hindered a lot of my economic mobility. This is about 10 years ago. More on that later, but the fact here is that we want to invest equitably in communities all across Wisconsin. That includes $25 million in efforts to address the social determinants of health, which include housing, nutrition, and transportation. So it's not just the specifically health or medical related issues that go into a person's overall health. It's the other outside factors that we also need to consider. And we're also seeking to allocate over $30 million to promote community-based health equity initiatives, investing nearly $30 million in a Healthy Women, Healthy Babies initiative aimed at improving women's health and birth outcomes. And also there's the point of expanding services and investing over $12 million to comprehensively address childhood lead poisoning. And then finally, increasing access to dental services all across the state to address the dental provider shortage.
Yeah, those are really important investments and initiatives that, because there's so much attention on other items in the budget, don't often get a lot of attention. So I wanted to make sure that we called them out. I wanted to pitch it to Krissa and Lisa, if you had any sort of last remarks or questions that you might have or want to make sure that you get out. This would be a good time to do that.
Well, the one thing I would say, Claire, my experience as a social worker, both at the county level and at the school district level, just really every day drew me into the inequities that we have in healthcare. People couldn't provide for their children the way they wanted to because they simply couldn't afford to do it. And families oftentimes, if there was a big crisis, a parent would have to leave their job because they made just a little too much money to qualify for assistance, but their jobs weren't providing healthcare coverage for them. And that's a big hit for a family, to have to make a decision like that. and really, I think causes so much extra stress in a family that just doesn't have to be there. I mean, Wisconsin was a progressive state. You know, we should be providing better for our citizens, and just to see those agonizing decisions people have to make, or as Lieutenant Barnes said earlier, you know, healthcare crises that push families into bankruptcy because the cost is just so exorbitant. That's my last comment on that. Thank you.
I just had a couple thoughts that I couldn't fit in. The first being, if you ask anyone if they think that people should, you know, not have access to healthcare due to ability to pay, they will say 100% no. So I just think it's time for our country's policies and our state's policies to really match what's in everybody's heart across the country. And secondly, just from a rural perspective, I kind of forgot to add this in, but my town has only 4,000 people. And I've been here, you know, 30 years, and it's just always people lamenting, why don't we have more small businesses? Why is our downtown dying? Why are there empty storefronts? You know, they want to blame somebody for why people aren't starting businesses. And I always say it's because of healthcare. If right now their family's being covered, you know, we all know how hard it is when you first start a business. You have no money for like the first 5 years at least, you know, and the thought of having an extra 20, 30, 40 grand in healthcare expenses on top of that, no, it's just not going to work. So until we fix this problem, we are not going to have more people able to start small businesses. It's really just that simple. So that was my other thought that I forgot to add. Thanks a lot.
Those are both really, really important points from Lisa and Krista. Thank you very much for sharing those thoughts. I haven't seen any questions come in from our attendees in the chat or the Q&A box. So I think we'll wrap up. I want to end by saying that, of course, this is a week of action. So we want to get the public awareness about these topics, of course, but we also want to encourage folks to take action by contacting their legislators. Please send emails, make phone calls, try to set up meetings with your legislators and their offices to say that you support BadgerCare expansion, you support a BadgerCare public option, you support a state-based exchange, you support prescription drug affordability in the state budget. These are investments that, like Lieutenant Governor Barnes said, are not just his and the governor's investments, they are the people's of Wisconsin's investments. And if we come together, we can win these things. So thank you, everybody. Thank you, Lieutenant Governor Barnes. Thank you, Lisa and Krissa, for being here and sharing your stories with us.
Thank you, Claire.
Thank you.
Thanks, everyone.